Hello, Assalamu alaikum. My name is Iqbal Bana. I live in West Yorkshire and have worked for most of my life in public services, working at different levels in different organisations, being Assistant Director in local government and Regional Director for one of the NHS organisations responsible for Yorkshire and Humberside. And I have for many years also worked within the volunteer sector as well. I happen to represent Her Majesty the Queen as a DL for West Yorkshire, which is Deputy Lieutenant, and for my services to the country I have also been awarded graciously an OBE, for which I'm extremely deeply honoured for both of those titles as well. Now, I come from a family which is very much connected and sort of united in the way they are. We're part of an extended family network, and unfortunately a few years ago my mum became extremely ill and not well and ended up being completely bedridden. And as a consequence we faced a number of challenges which none of us were aware of that we would face, because this is something totally unexpected. And we were working full time and we were having to care for our mother as well. There are 3 brothers and 2 sisters and our wives, and all of us had to pull together to provide 24-hour care to our mother, who sadly passed away last year. And during this time, without having external support, which we were not aware we could have had, we struggled quite a bit in trying to find support services for herself. How do we make sure that all her needs are met? How do we make sure that those support services like social workers, etc., can give us some advice and guidance? And all of us are, we would say, are fairly articulate, but even then, with our knowledge in public services, including my own, we've struggled quite a bit. And luckily, through means of some family and friends and some professionals, we managed to secure some knowledge and advice and guidance, and that made our life easier. I just wonder what it would be like for somebody who has no connections, no sort of relative knowledge or information about caring for somebody. So here we were, caring 24 hours a day, looking after my mum, our mum, and all of us chipping in to do whatever we could, including staying nights there with her, just to make sure that she was safe and she was comfortable. So carers play a very important and vital role, both paid carers, but much more so the volunteer carers within the family, where carers who volunteer to do such work. And I think we need to make sure that those carers get as much information and support as possible in order to make sure that they are safe themselves, but also that those people they're caring for get the best service that they can get. I hope this message will be of some interest to you and will resonate with many people out there as well.